Thank you so much. I mean, thank you for spending the whole or part of your Sunday afternoon with me. I'm Dr. Josh. I'm a urologist here. Today, what I'm going to do is to make the talk a little bit light-hearted. I'm going to talk about James Bond. Right? Last night I went to see, There's No Time to Die. So, Amy, do you think I can just get you to be kind of like interactive with me? Because I see that a lot of you send in a lot of questions. Later on, perhaps you read out the questions and we can make this a lot more interactive with you. Is that okay?
Sure.
Sure.
That's right. No worries.
Okay, great. So, kindly introduce me as this rock star, but, tell you what, when I, sometimes working in urology, patients always get confused between urology and neurology. They can call up the clinic and they actually ask, is this neurology? And then my nurse always say, no, it's urology. And then my patient will say, well, is that to do with the brain? My nurse always say, it depends on where your brain is, right? So essentially what we're going to talk about is what women should know about men. So, one first thing is that women always assume men has two brains, right? The upstairs brain and downstairs brain. So today what I'm going to highlight is that it's a few things that it's very, very important that perhaps men actually don't know about their private parts and that sort of things. And it's a good thing to know about and also to share with your clients as well and issues like that. As some of you may know from my book or from my background that I actually went to Cambridge and then I studied medicine there. And after Cambridge, I went to Oxford to do surgery. And after Oxford, I went to London and I did urology there. Many people ask me, why do you end up doing urology? Actually, when I was in Cambridge, I worked for somebody called John Dick. When I was in London, I worked for somebody called Andrew Ball. When I was in Oxford, I worked for somebody called Nigel Bullock. So, Amy, if you work for John Dick or Dick Bullock and Balls, you definitely become a urologist, right?
Yes.
Anyway, so a lot of you know that I deal with sexual health. Some of you may read my articles on Sunday that I have this article called Putting Dr. G on the Spot. And essentially what I do is that I deal with men's sexual health and a lot of issues about how men has treatment-seeking behavior, right? So I'm also an academician. I do a lot of research work in Monash University. And then the specific area that I'm looking at is the differences between men's health and women's health, okay? So Amy, can I ask you, who is your favorite Bond? James Bond. I know you're way too young to remember the ones who is in the past. Who is your,
No, I'm not that young. Pierce Brosnan, I think back in the year 2000 or
okay.
Yeah.
Pierce Brosnan, I think it's something like Tomorrow Never Dies or something, right? Pierce Brosnan is not my time. My time is way back, like Roger Moore, who died, right? Okay. So one of the things about James Bond is that all men wants to be Bond because it's like, very attractive, and then also the spy, and also very strong, and then so tough guys, right? The latest Bond, Daniel Craig is always perceived to be the blonde Bond who is really tough. So I want to ask you this question, Amy. Do you think men are tougher than women when it comes to health? Let's say if I ask you this question, are you more likely to fall ill than your male counterpart? Yeah, true or false?
I like to think
that, or are you a stronger gender?
I like to think that in terms of physical strength, in terms of, men can carry heavier things, okay, like lift a table or lift a car, but a woman probably do not have that physical strength. But in terms of pain tolerance, I like to think that female can tolerate pain better.
Okay, as far as pain tolerance, okay, is concerned, there are many studies to see that men feel pain a lot more than women because women can sit through or put through a childbirth. Of course, women are tougher in that way, right? But my question is, are you more likely to fall ill, or is your male counterpart more likely to fall ill?
Both my husband and I, we do not fall ill that frequent, but I'm the one that have the sniffles more frequent. Yeah, but I recover quicker.
So you're the weaker gender. Is that
I guess in this sense, yeah.
Well, I can tell you across the board, from cardiovascular diseases to any condition at all, women are more likely to fall ill than men, and that's proven across the world. Okay, but
Okay.
I'm going to ask you the next question. You're going to get spot on. Who lives longer?
Women live longer. This is the statistic that I know, that an average
Yes,
Malaysian woman lifespan is 76 and men 72. Is my number
you're
still
absolutely
correct?
right. Across the world, actually the number is a lot higher now. And then, Malaysian women live towards 78, 79 now,
Mm.
but Malaysian men live to about 72, 74. And then, so why is that the case, that men are supposed to be the stronger gender when it comes to like their physical strength and also likelihood to fall ill, but yet women actually live longer and outlive men? So why do you think that is this case? Do you think there's a conspiracy? All of you get together, all the women get together, and then basically they say, okay, kill the men. That's it, right? Okay, or make men live less long. So, do you think it's coincidence or it's conspiracy?
Not conspiracy. So I
Not
don't know.
conspiracy.
It could be female are better with handling stress, and men
Okay,
tend to keep everything
but
inside. So with stress, yeah.
if female are better in handling stress, then female should be the stronger gender. But yet, statistically, who falls ill first actually is women falls ill first. I can tell you that there's partly conspiracy and partly coincidence. I'll tell you why. Okay.
Okay, yes.
I have a data to show that across many conditions, let's say, for example, cancer. Let's use skin cancer, for example. Many statistics show that men are less likely to get skin cancer than women. So women are more likely to get skin cancer. But men are likely to die because of the skin cancer. And it all boils down to what I do for research is actually treatment seeking behavior. So
Mm-hmm.
if you tell a woman you have a breast lump,
Yep.
a woman will be there in the clinic straight away to say, I want this fixed. I want it fixed now.
Mm-hmm.
If you tell a man in my clinic that you've got a lump in your balls, or if they feel a lump in their balls, right?
Mm-hmm.
Okay, they will look at their scrotum every day and then they say, I think it's getting smaller. I think it's getting smaller. And they try to convince themselves in denial until they leave everything until it's too late. And that is one of the reasons why actually women outlive men. So that's one reason. The other reason is that women actually always have access to healthcare, regardless whether they're ill or not. So let's say women started having their period, their mother will take them to see a doctor. When
Yep.
women is pregnant, they're not ill, but they go and see a doctor. When they gave birth, they go and see a doctor. When they are menopausal, they go and see a doctor. So they always have access to doctors. But
Mm-hmm.
men will fix their car before it's
Mm-hmm.
broken, but will never fix their body until it's broken.
Yeah,
So
maybe.
men don't service their body, right? So that is the reason why when you come across the board, a lot of the time, men actually compromise on their health is because of this treatment seeking behavior.
Mm.
Interestingly, across all medical conditions, let's say cardiovascular diseases, mental health, everything, men tend to leave it later unless it's to do with their second brain. So if it's to do with urology, if their sexual health is compromised, they will come and see a doctor straight away. It's because their ego is compromised. And that's the reason why, one of the reasons why I become a doctor in urology is because I think mankind is not so kind to men. So we need to be advocacy for men's health. And so day like this in November, we always treasure this moment to highlight a few things that's important and then make sure that men go and see a doctor and service their body as well as they service their cars. Okay. So
Yep.
next question I'm going to ask you, why do men not go and see doctors? Why do men always kind of leave it until it's too late? Give me an example. Like for example, let's say Lance Armstrong, right? Lance Armstrong is a
Mm-hmm.
very famous cyclist,
Yep.
and he had testicular cancer at the age of 25, right? And
Yep.
he obviously famously got it cured and then won the cycling Tour de France 7 times, right?
Yep.
But he had the testicular lump as big as a football. before
Wow.
he had it removed and went and see a doctor, right, in the university. So how do you walk about with a scrotum as big as a football? It's extraordinary, right? So why do you think men tend to delay things a little bit,
One of
Amy?
our participant has put in a chat box, say that it's pride and ego.
Absolutely. Pride and ego is one of the most important things. Well said. The other thing is they're too scared. So whenever
Mm.
you scare a woman to say, you don't do this, you're going to die. When you tell men, you don't do this, you're going to die, men are so scared, they say, die, die lah. And that is, then they just give up. They say, it's like they did give up. And the other interesting fact is that a lot of things men don't know. They actually don't know. So it's like, British Telecom in UK, they have very intelligent engineers, right? They send out a questionnaire to ask them, where is your prostate, right? And then, so they have 30% of them say that the prostate is next to the kidney. And
30%.
then they have one, that's right, they have one question to say, women has smaller prostate, that's why they have less problem with urination. Is that true or false? 20% of them say yes, because men don't know. A lot of time men don't know, right? Okay. And the other thing is that men are too embarrassed. They're too embarrassed. I'll give you another example of men don't know, right? Okay. I run a clinic, it's on men's health, and I do fertility, or I deal with issues like men want to have vasectomy, right? So vasectomy is a form of contraception. So about 6 months ago, I had this man who came to clinic, and then he said to me, doctor, I'm here to have a vasectomy. So I explained to him, the vasectomy is actually removing of one segment of your vas. As a result of that, you won't have baby anymore. In the future, if you change your mind, we can join it back together. But it's not going to change your libido, your erection, the amount you ejaculate, and you're going to remain as a man. And he looked at me and he said, okay. So he went out to the treatment room in order to get himself ready. When I went to the treatment room and then about to do the procedure, my nurse said, 走走了. He ran away because he was too scared. And about 4 months later, he came with a woman who charged in the clinic and said, doctor, have you met this man before? I said, yeah. Did he come for a vasectomy? I said, well, he did come for a consultation for a vasectomy, but he left before the vasectomy. So he said, look, I am pregnant again with my 6th child. So you do the vasectomy and you do the vasectomy in front of me, okay? So I went into the treatment room and then I was about to inject his scrotum area with a local anesthetic. And he said to me, doctor, please stop, please stop. I said, why? He said, after you remove my testicles, what are you going to do with them? Then I said, you're coming for a vasectomy operation, right? He said, yes. And you think I'm going to remove your testicle? He said, yes. And then I said, and you allow me to do that after I spent half an hour explaining to you, and you don't know? He said, you see how fierce my wife is? You think I have a choice not to let myself having my testicle removed? So I said to him, I just kind of laughed and said to him, look, when you were getting changed, your wife told me to put them into a bag so that she can cook soup for you tonight. And he was shocked. And then later on, he found out that it's a simple procedure that made him completely sterile. And then he said, doctor, after 6 trials later, now I understand. So the other thing is that men actually don't know. They're scared. They're embarrassed. Embarrassing is one thing. It's because it's all to do with sexual organs. So men are very embarrassed. So what we're going to talk about today are 3 subjects that men should know about women, or women should know about men's health, right? Okay. So the first thing is that we're going to talk about sexual dysfunction, right? Okay, that's my area. The rock star doctor, Dr. G, is being put on the spot to talk about, G-spot and sexual health. Okay, erectile dysfunction. Okay, I mean, I'm embarrassed. My mom is staying with me at the moment. Every time I talk about like erectile dysfunction, my mom just say, "Aya, your my chun lah." And it's like, my mom doesn't look at this. It's like, this is selling like sex drug. This is like sex drugs. Okay. If I ask you, Malaysia came up with statistics actually showing that the number of people with erectile dysfunction. If I say to you, between 18 to 29 years old, Malaysia came up with this report card called Health and Mobility Survey, right, in 2019, just 2 years ago, showing that how many percentage of young men 18 to 29 have got erectile dysfunction. Can you just care to give me a number?
I think a
Just
number will be
any
low,
number?
between 19 to 29 years old.
Yes, to 29 years old, at the peak of their sex life. 10%.
Not more than, 10 plus, I'm not sure.
In Malaysia, is 36.9%.
Oh, that's quite high.
That's a lot. That means 1 in 3 men walking the streets of KL, actually have got erectile dysfunction. Initially, we thought it was over-reporting, right? Because people don't understand. Then we collaborated with all the statistics of people who's got high cholesterol, and we got all these, issues with depression, and then also hypertension, and then diabetes, and that correlate really well of younger men with all these problems. So we think it's a true figure, and it's almost like an endemic that is supposed to happen, is that erectile dysfunction is a precursor of a bad health. Do you know why? It's because if you imagine that the diameter of the artery that supplies the penis, it's a small organ. So if that is to get blocked first, right? And then that means that the larger blood vessel, such as the coronary artery and the jugular artery, is going to get blocked later on. So the erectile dysfunction is a precursor of somebody has got bad health. And that's why we may have a large number of men who has got early onset of erectile dysfunction and later on ended up with cardiovascular diseases, strokes, and also peripheral vascular diseases. So that's something that a lot of people don't know. And we just think about sex as an embarrassing thing, a stigma and taboo. But I'll give you more statistics. In the United States, 57% of men who were about to have a cardiac bypass, actually 3 years prior to their bypass, they informed their physician that they've got erectile dysfunction. Imagine that if this physician take this seriously, and then we can change a lot of things to prevent this person from getting a bypass. Another statistics in US, 64% of men hospitalized because of heart attack 3 years prior to that actually reported that they have erectile dysfunction. But the vast majority of us don't tell people that we have erectile dysfunction because we think it's all in the minds. We think that, it's all stress, it's all, the qi is gone, not enough sleep, and then, leong cha is not enough, and that sort of thing. And then you think that it is okay. And then after a while, the wife just say, not interested anymore. He's probably outsourcing. And then, but the reality is that majority of people, number one, they're too scared and too embarrassed to face this. They miss an opportunity to identify what's the cause. And the second thing that they worry about is that relationship between the husband and wife will slowly disintegrate, because sexual bond is quite an important thing in most people's relationship. So the next question I'm going to ask you, what is a healthy amount of sex that someone should have? I know we shouldn't be asking a woman something like that. It's a Sunday afternoon. Let me phrase it in a simple way. In Malaysia, how often do you think you look like you're under 40, right? How often will an under 40-year-old couple have sexual activity for under 40 in Malaysia? How many times per month?
Minimally
on average,
once a week.
Average.
Averagely 3 to 4 times a month. Once or twice a week. Yep. So we have one of our guests.
Once or twice a week. In Malaysia, actually, it's about twice a week, which actually works out to be 8 times per month. And beyond that, age of 40 and above, obviously it gets less. It's about 6 times a month. And that is a sort of usual thing. So, all these cosmopolitan portrayal of men think about sex every 7 seconds, obviously that's complete rubbish, because at the end of the day, if you think of sex every 7 seconds, you have no time for anything else, right? You can't think of anything else. But sex is something that brings out the attention in men. So when you talk about sex, sexual dysfunction, men will just get alert and then start thinking and start comparing themselves. So that is something that we really want to highlight using November month to talk about sexual dysfunction, is something that can bring their attention in rather than pushing them to say, hey, you don't get yourself checked out or you're going to die from cancer. Huh? So we use sex to lure them in to talk about this, right? Okay, so some sexual facts, right? Okay, can too much sex damage your kidney?
I like to think that no. Answer is no.
Okay. Okay. This came from the 儒家思想, right? It's all about from the Confucius time that actually too much sex is draining your qi, right? Okay. And the qi comes from the kidneys. But the reality is that when you translate to modern technology, you kind of say qi is kidney function. And then so when you have too much sex, you drain your qi and your kidney fail. But in reality is that you need to like ejaculate huge amount of fluid to get yourself dehydrated to actually get into kidney failure if you want to use sex as a modality to induce a sexual failure. So that's something that it's completely a misnomer. It's a myth, right? Okay, so can too much sex cause infertility?
My answer is no.
No. Okay, Australia show that on the contrary, men who ejaculate more often actually have higher round of turnaround so that healthier sperms are visible. So for the listeners out there who actually are trying for babies and you accumulate all that sperm and you think, okay, right, okay, I'm going to use all that 2 weeks of accumulated sperm so that we just on the ovulation day, I'm just going to supply that to create a baby. It actually doesn't work like that. What is shown is that frequent ejaculation actually help to regenerate newer sperms. So therefore, the older sperms that actually can cause miscarriage is not there. So therefore, something like that, again, it's a kind of misnomer, right? Okay. The other thing that is from our Asian setting, we all say that, hey, you ejaculate too much when you're young, you're going to end up with erectile dysfunction. There's none of that. But some people even come to the extent that to say that if you have too much sex younger days, you're going to end up with cancer, right? Okay, so this famous study actually was done because of all these concerns that people have. Is it too much sex that is so sinful that you end up with prostate cancer later on? Okay, so in United States, when they have New England area, it's a big 4 states, Vermont, New Jersey, and these sort of East Coast counties, they get together and they recruited 30,000 men and monitored them over 30 years and asked them to fill in questionnaire and say how often do they ejaculate. And then 30 years later, see how many of them actually get prostate cancer. So conclusion, what do you think? Too much sex, get prostate cancer, or too much sex will protect you against prostate cancer? This study was done in Harvard.
I don't think too much sex will cause cancer.
But would it protect you from getting cancer?
I don't know.
Maybe you're blushing,
I guess, yeah, I guess if you are saying that no too much sex will protect cancer, that will encourage people to have more sex, so it's actually a good
It's
thing.
a bad thing. It's not necessarily a bad thing. Actually, the study actually did show that men who ejaculated more often have 25% less chance of getting prostate cancer 30 years down the line. 25%, that's a lot in 30 years.
Yeah, that's a lot.
Right. That's a lot. So then are we sending out the wrong message to say, men, you should have sex more often because that will protect you from getting prostate cancer? So this is the question that people always ask me, Doc, how many times is enough to protect you from getting prostate cancer? So what does the study show? Do you want to hazard a guess? How many times per month so that you can protect yourself by 25% 30 years down the line? This is not frequency of sex. This is frequency of ejaculation. Hey, you run away. Just so scared of my question.
Sorry, my laptop was running on. I need to turn on the switch for my laptop. So no, I'm still here. Yeah. I think the number for your question, 8 to 10 times a month.
21 times. Imagine.
21 times.
21 times per month to reduce your chances of getting prostate cancer by 25%. So in conclusion, when we talk about first segment of sexual health, in reality, is that sexual health, if you have impairment of sexual health, it's a precursor of something is wrong with your body. It's either vessel is impaired, or if you have got hormonal problems, or you've got early aging. And a lot of all these things that we worry about as Asian, about the chi, about too much sex is bad for you and that sort of thing, has no scientific basis. In fact, on the contrary, a lot of things actually show that it's good. I mean, many people ask me, so doc, does that mean that I have to have frequent sex to do that? I say, look, just listen to your body. If your body feels like you need to do that, you do it. But if you have problems, then you go and see doctors earlier, because it might just be that 57% of people 3 years down the line may need a bypass or had a heart attack.
Yep.
So if your body tells you something is wrong, for example, you begin to get erectile dysfunction, you begin to have low libido compared to the past, you begin to get premature ejaculation, then you really do not treat this lightly just because you think that it's stress and you're tired. Just go and see a doctor to get you checked out, because if you can service your car all the time, you need to service your body before it's broken.
That's
right? Okay.
Right.
So
Correct.
the next segment I'm going to talk about is the big C, prostate cancer. Okay. A lot of us worry about prostate cancer. I think we should in our country. Okay. I'll give you statistics, right? Okay. I worked in the UK before for many years. And in the UK, 67% of men presented with prostate cancer are early stage 1 prostate cancer that is curable. So you mean that 2 out of 3 people presented with prostate cancer are curable. Okay. So I'm going to ask you that question. How many percentage of men presented in Malaysia presented with curable prostate cancer?
Will be more than 50%. You were saying that
No.
every one with curable?
No. In UK, that means that out of 10 people, 6 of them we can cure. In Malaysia, out of 10 people, only 1 of them we can cure.
That's really low.
Because what we highlighted, that it's because of late presentation, right? It's because you have no idea where the prostate is. You don't know about screening. You worry about doctors putting up their fingers up your bum. You worry about blood tests. You worry about pain. You worry about biopsy. Then the only time you go and see a doctor is when you can't pass urine, when your bone is painful, when it's already spread to the bone. Therefore, it's way too late. And it happens in those areas that really require us to focus on. Poor socio-economic background states like Sarawak, Sabah, Kelantan, my home state, a lot of people present late. It's only in the states such as Selangor, Johor, and also Penang that where there's lots of campaign, lots of all these, awareness, webinars like this, that people know that they need to go and get themselves checked out. Okay, let's talk about symptom first. Prostate cancer is silent, right? You don't have any symptom at all until it's too late. So therefore, a lot of the time people ask me about all these prostate symptoms. For example, they will ask me, doctor, what sort of symptoms do I get? In fact, there are 7 symptoms that men get from prostate. Frequency at night, urgency, when they need to pee, they can't pee quick enough. Then sometimes they wet themselves. And frequency during daytime, when they're about to start, they have to wait a little bit, and then they can only start. You can see those men for men's room, when we go into a men's room, you pee and you get out, and then those men are still waiting and waiting for the urine to come out. So after 3 men have used the urinal next to you, you're still struggling to pee. And after you pee, it dribbles, and then you need to force it, and those are the signs that prostate has gone wrong. But don't worry, the vast majority of this is not cancer. The vast majority of it is just aging. But the aging itself can be quite bad anyway, because the aging itself, it will block your kidneys and it will cause problems. So therefore, to get yourself checked out is a simple process of, first of all, a simple blood test called PSA, which is a blood test for tumor marker. And following that, the doctor will do something called digital rectal examination. apart from being called the rock star of the doctors, I've been called the gold finger, right? Okay. It's because this finger goes up a lot of people's bum to feel the prostate. And, and this finger can tell, and a lot of doctors who are experienced can tell whether this is cancer or not. And if in the event that it's cancer, we will pick some samples and prove that it isn't. And these days, there's so many treatments available. There's radical prostatectomy, there's robotic, there's laser, and therefore there's no fear that if you lose your prostate, you'll lose your sexual libido and your sexual function. Because the only fear you have is that if you present late, then you're going to lose your sex life and you're going to lose your life.
Yes.
So therefore, imagine in our country, compared to the Western world, we only have 10 to 20% of men presented at early stage. And then vast majority, 80 to 90% presented late and not curable. And therefore, prostate cancer is something that we really need to talk about. I persuaded a friend of mine, Nazir Razak, to come, to go public about his prostate cancer. He's 51. He's a good friend of mine for 20 years. He called me up one day, and actually 2 years ago, and said to me, Josh, my PSA is 5.4. PSA should be less than 4. And then when I said to him, don't worry, like you're 51, nothing to worry about. Get an MRI scan, and then something is abnormal, had a biopsy, and it can happen to anyone. And it was positive. He had it removed. Luckily, it was early stage. He's cured, just like Lee Shen Long. I can retain his sexual function. And I persuaded him to go public. He came up with the CIMB Foundation money and actually came up with this campaign called Only Men Can. And then we're doing a webinar next week. He's going public. It's gone on Meletup. It's gone on Astro Awani. It's because he wants more men to do PSA study. And he wants more men to know that it's not that scary, right?
So,
just to get yourself checked.
Yeah, Dr. Josh, we're not talking about PSA study to do a test. So when should a man go for such screening?
Okay, 50-year-old is the cutoff because that's when the prostate really go a bit haywire. If you've got prostate cancer in the family, or if you've got maternal or grandma's side who has got breast cancer, then you really need to do it earlier at 40. It's because of the genes that affected Angelina Jolie. It's called BRCA genes. It's the same genes that actually can affect men to create prostate cancer. Therefore, if you've got family history of breast cancer or prostate cancer, do it at 40. Otherwise, do it at 50 and above. And it's once a year.
Once a year, 50 and above, for those who do not have a family history.
Okay. So my last segment, which for the next 10 minutes I'm going to talk about, is something that affects the younger folks, because I know you have many of the audience here is young. We started off with erectile dysfunction that affect younger people and older people. Then we talk about prostate cancer that affects 50 and above. Then I'm going to talk about HPV, right? Okay. Earlier on, I said to you that there's a conspiracy to destroy men. So I ask you whether it's nature or nurture. I can tell you that actually both nature and nurture cause men to have problems. I'll give you an example of a good example of HPV. HPV is human papilloma virus. We all are aware that HPV is a woman's disease because it affects women with cervical cancer. Okay, so therefore, HPV vaccine was discovered about 13 years ago, and it was rolled out and to be given to girls under the age of 13. So before they had a first sexual contact, they're protected against cervical cancer. But what many people don't know is that HPV also infect men. And then it's the men who pass the disease, the virus, to the woman to cause them to have cervical cancer. So many years ago in the 60s, which you don't remember, that rubella used to affect girls to make them infertile. So for 10 years, they just injected women with rubella vaccine. And then they realized that, they can never cure the disease is because they forgot about the boys. It's the boys who pass the disease. And then eventually when they eradicated with both boys and girls, only then they can eradicate the actual rubellas. So HPV is another interesting thing to highlight vulnerability of men. If you look at HPV amongst adults, right? For women, you get the disease. Even if you don't get vaccine, the disease will fall from the age of 40 because your body built up an immunity
Yep.
to go against it. And this is even before the vaccine. But for men, when you get it, it continues to go up and stay high. And that's very strange. It's because men don't have the intrinsic ability to raise the antibodies. And so therefore, men are more likely to get reinfected, and men are more likely to get transmission from women compared to women transmit to men. Right? Okay. So let's say a man transmit to woman, it's only about 12%. But the other way around, women transmit to men is much higher. So all these shows that men are vulnerable intrinsically. Number one, their body can't build immunity to fight the virus. Number two, once they get the virus, they actually are more likely to get it again. Number three is that women are more likely to pass it to men rather than men pass it to women. So with those, intrinsically is nature that actually make men more vulnerable to HPV. And the HPV in men can cause oral cancer, famously Michael Douglas, can cause anal cancer and cause horrible, horrible genital warts. But most importantly, if the man harbors HPV, they will continue to transmit that to women, and women are getting the cervical cancer continue to stay high. So countries like Australia suddenly realize that, hey, hang on a minute, if we don't protect the men, then the men has no chance. So why don't we just spend money on the men? And interestingly, 8 years down the line, they realize that their rate of suppressing cervical cancer is significantly higher than any other country that only vaccinated girls. So therefore, not very few countries, we assume that it's a woman's disease. And this is a lot more serious when you get cervical cancer. And it's self-inflicted by men. And then genital warts is no big deal. But the reality is that Australia will be the first country in 2025 that can eliminate cervical cancer. But the rest of us still think that it's a woman's disease and there's no need to vaccinate the boys.
Wow.
Isn't that extraordinary?
So yeah, it's actually a new info because like you mentioned, many people thought that HPV only affect the girls or a woman.
Exactly. So today's title of the talk is what women should know about men's health, right? And then this is one of the probably the biggest thing that you should know about men's health. You know, I put up my last slide on my PowerPoint, which I'm really sad that I couldn't share with you. It's my Instagram picture of my son and my daughter. I have a son who's 21. I have a daughter who's 19. You know, my handle is, Dr. George Lee, DOCTOR George Lee. So if you want to private message me or anything like that, you can just follow me and then private message me. But I'm going to show you one picture of both of them together. I tell you, sometimes I feel that in society, we are fighting for gender equality. We know that the society always focus on men as far as career, as far as politician, as far as position in school, access to a lot of things is because it favors men. However, when it comes to healthcare, I hope today's talk basically highlighted that although physically men might be strong, but men are vulnerable both intrinsically and extrinsically. It's both culturally and also their intrinsic ego. And all these combination is the answer of the question, why do men never outlive a woman in any countries, at least by 5 years? So I put up the last picture showing my son, my daughter in Instagram for my son's graduation. Actually, it was my son's graduation. And I said to myself, I'm an advocate for men's health. It's not because I feel like, hashtag me too, or I feel like, I need to I'm an activist. I think culturally, men has a lot of disadvantage. It's because healthcare is designed not to service men before they're ill. And culturally, men are trained or conditioned to be told that tough it out, because never cry, just tough it out, you'll be fine. And that's the reason why suicide rate is higher in men, because some men just can't tough it out. That's the reason why men tough it out until when it's too late, that only 10% of prostate cancer is discovered at early curable stage in Malaysia. That's when they tough it out, that when they get erectile dysfunction, 3 years down the line, they get heart attack. So November is just a time just to say, man, hey, you don't have to tough it out all the time. Just sometimes get yourself checked out. It's not that embarrassing, and it's not really that too much of an ego dent to you. So on that note, I'm really looking forward to answering those big number of questions that you guys have in stock for me. Thank you very much for listening. I'm terribly sorry again that I don't have PowerPoint. I hope without the PowerPoint, the talk is a lot more intimate.
Yeah, thank you, Dr. Josh. Yes, it is. It is a lot more intimate because we are really focused, on your screen, okay, instead of looking at the notes. Like you mentioned earlier that no, it's good. Like we mentioned earlier that men are in many ways are being told to tough it up, and a lot of them do not have screening. But I see a lot of men, they do screening, but not. I'm not sure whether do they go on that their private area. But I see a lot of them go for regular checkup, especially on the heart, on their cardio with blood tests. Is that something that's missing out, that they didn't do it?
Yeah, well, actually, today's Star came out with one study to show that if men screen more often, they're more likely to detect a lot of things. So, I mean, in Malaysia, we talk about many men do these executive screening. It's like once a year. I think once a year is enough, but that is minority. Those are the minority of people. The vast majority of men, they're either too scared, or they're too busy, or they have 1001 reason why. The last time when I had this study to show that if you ask men, when was the last time you had a blood test done? They always say last year. And then when you look back, it's always at least 5 years ago. So it's always last year. It's like, it's extraordinary.
So like what you mentioned about the seeking treatment behavior is not in them. Yeah, as more
Right.
more frequent that the girls or the female they see.
Yeah. And then the style that you do it for men should be different, because for women you say that if you don't do this, you're going to die. For men, if you do this, they run away. So that's why campaigns such as anti-smoking campaign, if you say you smoke, you're going to die, it doesn't work. But if you say you smoke, you're going to kill children and women because you're smoking, then they start thinking about it. So therefore, the campaign needs to be a little bit more, focused. Okay, so Amy, I've got a lot of questions here. I'm going to look at the box and answer. Does it have any side effects? Will it prevent pregnancy 100%? The answer is 99.9999999%. Yes, well, it doesn't have significant side effects because the men will continue to produce the amount of semen, the color, the texture, the amount, everything is the same, their libido, their erection. So virtually no side effects. But for women to have it done, general anesthesia, sometimes injury, and significantly more expensive. Because the vasectomy in men is only about 3,000, 3,500, but for women it's like 10,000 or something like that. So it is significantly more difficult. Doctor, is Duoda for enlarged prostate, is there any side effects? Yes, Duoda has got 2 significant side effects on your sexual health. It will suppress your sex drive, and it will make your ejaculation go backwards. So you ejaculate dry ejaculation. So unless you really need it, don't take it. Okay. What causes Peyronie's disease and how to prevent it? Peyronie disease is when you have a bent penis or bent cock, right? Okay, so it's caused by a scarring of connective tissues around the penis. The most associations with Peyronie disease is either traumatic injury or diabetes. So other reason why it's really unidentified, so it's idiopathic. So we can do a small operation, which actually will make the penis straight again, but it will shorten your penis by about 1 to 2 centimeters. Okay. So what else? What will happen if a guy hardly have sex life once or twice a month? And what's the cause of erection for a man or nearly 60? So what happens? Actually, like I said, we all individuals. Some people have sex twice a day. Some people have sex twice a year. So just follow your body, and it doesn't matter what causes erectile dysfunction in a man nearly 60. So the commonest reasons, 60 to 7%, we call it organic reasons, such as high blood pressure, high cholesterol, low testosterone, and diabetes. So get yourself checked out once or twice, and then that will be good. Welcome to Men's Health Club. Please, as you're registered, okay, that's okay. Okay, right. So we got some WhatsApp questions, right? Do you want to read them out to me, Amy?
Yes, that's
Yeah.
right. Okay. So these are questions that were sent in the registration form to attend Dr. George talk today. If men take statins, will they gradually have memory losses?
Okay.
This is not really.
I'm not a cardiologist, but I think statin is every 10 years they come up with new study to show that you shouldn't be taking statin, and then next year they should be taking statin.
Yes.
Personally, I think that if you can get away without statin, is the best. Exercise, and then I lost 30 kilo in about like 3 years. My cholesterol is flawlessly good. I don't take anything. Why? It's because I eat a lot of salad and I hardly eat anything else. It's because you abuse your body all your life before 40. Now your body will abuse you. So it's time to catch up with a lot of things. So unfortunately, there's no easy solution. All of us want easy solution like statin. And of course, a lot of things have side effects, but I don't think memory loss is one of them. Okay?
Okay. Next question we have, how can a man with prostate disorder maintain his level of health?
And, okay, the prostate itself, in Chinese, we call it dantian, right? Okay, right. So basically, it's actually where it lies between the penis and also the bladder itself. So the prostate get enlarged regardless. So if you live old enough, then your prostate will grow, unless you've been castrated, like if you're a taikam, right? And then your prostate will never grow. So that is because we have testosterone to make the prostate grow. And then in order to maintain that level of healthiness, you need to do 5 things. Number 1, hydrate yourself. Always hydrate yourself. Number 2, enough sleep, because that will maintain good level of testosterone. Number 3, cut down on meat, especially meat that is hormonally treated. Cut down on food that is treated with pesticides, and increase on organic food and also fruit and vegetable. Exercise about 30 minutes per day, because that circulation will help, and reduce stress, and enough sleep of more than 7 hours. These 5 things, you can do it, your prostate will stay pristinely good for the next 30 to 40 years. And also food that will help you, soybeans, and then pumpkin seeds, green tea, cauliflowers, cabbages, tomatoes, broccolis, and those are the things that will help you to maintain good size of prostate.
Okay. Is there any nutrition advice to reduce frequency of urination at night?
Okay, there are several things that can cause frequent urination at night, and then that's called diuretics. So if you drink caffeine, so the coffee, tea, that actually can induce diuresis, not good. And the other thing is spicy food contain capsaicin, can make your bladder contract a little bit, make you go to toilet a lot. Alcohol is particularly bad, so cut down on alcohol, especially at night. And those things are the ones that cause you to have frequent urination at night. So spicy food, alcohol, shellfish, uric acid, nuts and beans, those things should really cut down.
Okay. Is there any exercise that can help men with urinary tract and prostate disorders?
Well, there are studies to show that the pelvic floor exercise that we teach women after childbirth can strengthen your pelvic floor. We particularly teach men before they undergo prostate cancer operations, and pelvic floor exercise can strengthen your pelvic floor. That's particularly good. So that's something that can do. A lot of my clients tell me that qigong helps a lot as well. So something like that you should look into. Although there are not too many studies to do that, this is anecdotal.
This last question, the same person, is how do you take care of feelings of parents who are so sensitive, likes to be angry indefinitely? Are you able to give any advice on that?
Look like that. Yeah. Looks like now I'm a parent counselor. Well, I tell you, my mom's outside, but I used to be so angry with my mom all the time, and my mom used to be so angry with me all the time. I think I tell you what, I'll give you a tip, right? Okay, just say yes to everything, right? Okay, just say yes, everything. One day she'll come around. Even though you're frustrated, hey, I was told that if you're angry with somebody, you're angry with yourself. So why be nasty to yourself? Don't be angry with yourself, especially your parents. I also felt really sad. Some of you read my books about how I felt sad about losing my dad. It's like the one thing that you don't want to do is regret after you say so many years of being angry with your parents, and then suddenly, or your parents angry with you, and suddenly, you lose your parents, because at some point we all do. So, you have that regret. So even your parents are angry, it might be hormonal, they're frustrated, they have things that they're unresolved. It doesn't matter. Just be kind to them. After all, without them, you're not here, right?
Yeah, that's right. Next question we have is related to memory lapses.
Okay, right.
Okay, yeah. So how to manage telling family members of the memory lapses, and what can be done to encourage senior family member to focus or remember?
Okay. Right. One thing I would say is that apart from all these things that I mentioned about sleep, about hydration, about exercise, about diet, and then about less stress, one thing that you need to use your brain a lot. Okay. So you don't use it, you're going to lose it. So in UK, they have these studies to say that you use Sudoku. So basically a lot of mathematics in order to get your brain going. So the things that you really need to do is specific discipline. Chinese were very good in this. We wake up at a certain time, we have this discipline, and then we also need to have the discipline in order to get variety to that, get your brain going. So don't stick to the same thing. So you have routine, but yet you always add new things to it. Like, for example, for me, I feel like I have lapses all the time, and that's part of aging. And one of the things to beat aging is that I want to learn new things. Like, you follow me on Instagram. I started doing pottery.
Yes.
I started going to poetry classes. And then next week, I'm going to do knitting classes, right? Okay. It's like all these things sounds a little bit gay, but hey, you know what? I've never done it before. I don't know whether I like it or not, but it's okay. I just wanted to do something so that I can keep my brain going. And that's one thing that I want to do, is just ask myself, if not now, when? It's like, I'm going to climb Kilimanjaro in February. I have never climbed any mountain apart from Mount Kinabalu. But if not now, when? So I live my life with a motto of just treat today as your last day, right? Okay, so with that, you will just get your brain going all the time. Forget about lapses, because when you're so busy and creating new things for yourself, your brain will be running for hundreds and hundreds of years.
Okay. Yeah, I agree. We live your life as if like today's last day. We have
That's
two more person that have a few questions. Please explain the differences in cause, diagnosis, and treatment of BPH versus overactive bladder versus nocturia. Do these conditions have any correlation with liver or kidney function and sleep disturbance? Do patients have to take medication long term, or are there any?
Okay, good. Sure. Let's go with BPH first. BPH is benign enlargement of prostate itself. It causes blockage. It's just like the tube is blocked, and then you cause the blockage. So patients tend to have slower flow of urination. And when they retain urine, they go to toilet more often. Then that concurrently have a similar problem with something called overactive bladder. Overactive bladder is when your bladder just contract and contract and contract all the time. And that can be provoked by food, caffeine, alcohol, and so on. And lastly, something called nocturia, or something called nocturnal polyuria. Basically, that means that your brain has a hormone called antidiuretic hormones. It's not producing enough of that to stop you from making urine. Sometimes all three of them can come together. So therefore, a urologist needs to identify what is causing this. A lot of times, something called sleep apnea, which is an obstruction of your tongue to your brain, to your mouth, so that your airway is blocked. And then that lack of sleep itself will create all these problems of your bad health. So something like the sleep needs to be looked at. So sleep disturbances definitely cause it. The long-term treatment, actually, at the end of the day, is healthier lifestyle, lose weight, and all these things that is too boring. But a lot of us wanted a pill. The pill is a temporary relief of symptoms. But the real way to relieve the problem is really no shortcut. Just need to put in an effort and put in an effort to live healthily.
So live healthy is the main key. Okay. The next question that we have here is about menopause. To comprehend menopause, what caused their anger, impatience, hot temper, and change of character or personalities during menopause, and food to help. What if this person refuses to exercise? What's the next best thing to do?
Okay, men supposed to have no pause. Women have menopause, but men no pause, right? Okay. But the reality is that when your fountain of youth, our fountain of youth is our testosterone. When your testosterone lowers, then you really body will change. And then some people call it androgen, some people call it late onset hypogonadism, some people call it male menopause. Whatever you call it, your body change, and sometimes it's part of aging. So that's when you put on weight, your memory get a little bit less sharp, your drive is not there, your sex drive is not there, your erection is not so good, you're grumpy, and all that can be just part of aging, or you refuse to accept it. Some people refuse to accept it. They will go for age reversal intervention, and some people will put in the hard work. So this guy said, if you refuse to exercise, what's the next best thing? Yes, we can give you your fountain of youth. We can just create testosterone. We can inject into you as long as you want. But everything we give to you has a price to pay. It's not just because of the money that the price to pay. It's because all that changes in hormone can eventually translate to something else. And the most scary thing is prostate cancer. It's just like for women to have HRT, there's a small risk of endometrial and breast cancer. For men, it's equally the same thing. So there's no such thing as free lunch. Get on those bikes, get on those jogging shoes, and get running. And that's the only way to get your testosterone and also your fountain of youth continue to supply.
Yes, I love your saying. There's no shortcut. Okay, you have to really eat well, exercise. We have one question in the chat box just came out. How about males who are single? Will they have higher chance of prostate cancer?
Well, okay, early on, I said to you that the number of ejaculation, right? I didn't say the number of times they have sex, okay? So a single man probably ejaculate a lot more than a married man. I can assure you that if they have nothing else to do and don't really need to create a date night and that sort of thing, your right hand and your left hand is always your best friend, okay? So the number of ejaculation, actually, there's one caveat to the study I tell you. A lot of people criticize this study to say that younger, healthier men have more sex anyway. So these are the healthier men who eventually live to have less prostate cancer, right? So if you imagine that you're not so healthy, then sex is the last thing is in your mind. So eventually you'll get prostate cancer anyway. But if you're healthy and then you're sexually very active and then you live a very healthy lifestyle, then you will have less prostate cancer and any other form of cancer. So the reality is that if your sex drive is there, then don't refuse it. That's my only advice, right? Don't feel like you need to refrain from that because the chi is going to disappear. So therefore you say to yourself that, no, I can't. Already ejaculated like 2 months ago. So, whoa, cannot. And all those are the things that actually put a lot of guilt in you, put a lot of stress in you. So just listen to your body. If you're single, you're not that sexually inclined, then just be it. If you're single and then you masturbate all the time, then be it. So all of us are different, and the hormonal level they determine how active or how less active you are. It's completely variable. So follow your body. Just listen to your body.
Okay. All right. So the answer is no. Single men, okay, doesn't mean that they have a high chance of prostate cancer. Someone in the guest asked for your Instagram page. I will share that later, okay, for Dr. George Lee's Instagram page. And
so I'm
there's a
gonna
question.
get my number up. I'm at least 61 now. Hey, so happy.
And now,
right?
Next question is, Doctor, you have published 2 Chinese books. When is the 3rd book coming out?
All right. Okay. I tell you what. Sincho actually published my first book. I'm very grateful because they make me the rock star that I am. They make me shameless. They make me so thick-skinned that I can write anything about my past and my stories in a short stories. But my 3rd book actually is called Pu Gong Ying. Pu Gong Ying is a story about the correspondence between my children and me. So basically, they ask me about my how I view many things. And then my response. And then so I felt that I told them this was the book that I wrote, and then they said, Doctor 这样老了不要写了啦，给年轻人一个空间啦，那个榜位整天站着，年轻人 said. So suddenly I felt so old. It's okay, I'm only 52, and then they felt that I said 淘汰. So it's not that because I don't want to publish it, it's because they don't want me anymore. So nala. So they just don't feel like, you know, that sort of like story. It's the flavor of the month. I had a good run, you know. I don't know, sold about 30,000 copies. For those of you who really want to have a copy of the ones that, because it's so bad that they don't sell the first two books anymore. First book is called 生命没有如果. The second book is called 医院我的乌托邦. And then if you really want it, I bought like whatever is left behind. I told them don't sell this anymore. I'm going to keep them. So if you want, private message me, I'll send it to you. So, you know, I'll sign a copy even for you.
Wow.
Because the third book it's my 珍藏品. So what I'm going to do is I'm going to put it together. I'm going to give to my children as gift when I die.
Yeah. Okay. It's amazing, you know, with the which is a good memory to leave behind for current generation and next generation, to your grandchildren and more to come. So
well, they say you leave your legacy, but I tell you, it's a bit shit.
Okay, so up on the screen, I'm sure everyone can see this is Dr. George Lee's Instagram page. I have put it up. I'm also her follower, and many of our attendees who have attended talk in February and also part of our team.
Then you found out that I was late because I was treating my mom for lunch, and then she was eating so slowly that I just said, Mom, can go things. And then my mom said, Aya, 不要紧啦, 不要紧啦. And I was like, I cannot be late.
Right. No worries. All good. And I understand that today is Sunday, so actually it's your leisure day. So we really appreciate you being with us here today. I think we've answered all questions. If any of our participants today who want to speak with Dr. George, feel free to let us know. Then our host will unmute you so that you can share. Okay. So thank you so much.
Actually, Amy, if you whoever wants my number, actually, I'm going to say out my number here because it's at the back of my card anyway. So, you know, if you need to contact me for any medical issues or anything, private message, a lot of when it comes to sexual health, men always say, my friend needs to know whether the testicle is painful on the left. Your friend, my neighbor. It's like, so if your neighbor needs to find out more about the left testicle, you know, you can always call me, text me 017-686-2828.
62828.
Yeah, that's right. And if you want the book, you know, just WhatsApp me your address, and then I'll sign the copy and send it to you. Okay.
Thank you so much, Dr. George. Yeah, 017-686-2828. Wow.
That's right.
Okay.
Ifa.
Thanks so much, Dr. George. That's really very generous of you, and forgive our number. Okay, we really appreciate it. So with this, we're going to thank Dr. George Lee again for being with us here today, and also to Gleneagles Hospital Kuala Lumpur, the marketing team who have arranged for Dr. George to come back here today and a second time today. So the next slide that I have is Dr. George information on his clinic at Gleneagles. Yeah, and Dr. George can speak multiple language, you know, Mandarin, Hokkien, Malay, and Cantonese as well. Okay, so you can make an appointment on this clinic number. So next is tell us what you feel about today's talk. I'm sure there's going to be a lot of positive feedback. Okay, so put in your feedback, and then we will channel and we will send all your feedbacks to Dr. George. Okay, on all your feedbacks and positive comments. So our next talk, next is we also have a Gleneagles. Follow Gleneagles on their social media in Facebook, in their Instagram, and also LinkedIn. And Gleneagles page have a lot of health information. Okay, it's very useful and also very knowledgeable to everyone. All right. So Pioneers is part of Prudential. So Prudential have launched this new plan called the Pro All Care. Pro All Care is a new benefit that covers up to 190 types of health condition, comprehensive health coverage, and also Pro Health Care from Prudential is the very first plan that give a large mental health coverage. Okay, and also cover post-surgery recovery benefit as well. So speak to any of us that invited you here today to find out more about this benefit. Okay. So next health talk will be 5th of December. That will be our last talk for the year 2021, 5th December on a Sunday, 3 o'clock. All right. So as I mentioned earlier, today has been our 27th episode that we have been ongoing having this virtual talk since April 2020. So thank you so much for everyone on your attendance and has been supporting us and telling us about your friends to our friends about our talk. We really appreciate the question that you have, because for me, hosting this talk for the past 1.5 years has been a tremendous experience. Okay, I've learned so much and it has been really helpful. So mark your calendar, 5th of December, Sunday, 3 o'clock. You can scan on the QR code to register. The topic would be, do you really need a knee replacement surgery? So this topic came very right time, because last week I have a client who just had a knee replacement surgery. So mark this down, okay, on this date and join us. All right. So when you register, the Zoom link and ID will be given to you nearer to the event. Okay. Last, this will be me. This is the link of the website that I have all my information of my social media, my Facebook, my Instagram, okay, and also my WhatsApp number, that if you want to write to us, okay, or message us privately. And this is the group, our group that we have been hosting this talk for the past 27 episodes. Yeah, so our group is called the Pioneers Financial Services. We have a Facebook page. All right, can hop by to follow our page and to know more about financial planning services that we offer. Okay, so with that, we will end today's session. Don't forget to give us your feedback form and also join us in our next health talk in December. Thank you so much, everyone, for being with us here today. I wish everybody good health, has a fantastic rest of the Sunday, okay, and fantastic rest of the month. All right, our final 2 months in the year 2021. Okay, so take good care. Thank you once again. All right, I see you again soon. Thank you.